Let's talk about congenital solitary functioning kidney. It's a condition of being born with only one functioning kidney, majority asymptomatic, with compensatory hypertrophy of contralateral kidney. Okay, because you're born with one kidney, you're asymptomatic because one kidney is functioning normal. But there is going to be a hypertrophy of the contralateral kidney. Okay, but anomalies in the contralateral kidney are common, often diagnosed prenatally via ultrasound. So let's talk about those anomalies now. We have the unilateral renal agenesis, unilateral one-side renal agenesis. So ureteric bud fails to develop an induced differentiation of metanephric mesenchyme, which leads to complete absence of kidney in the ureter. That is one thing. That's the one thing. And second thing we are looking is the multicystic dysplastic kidney. Multicystic dysplastic kidney. Again, we have the ureteric bud which develops but fails to induce differentiation. Fails to develop, and now here is just the same thing, right? This leads to non-functional kidney consisting of cysts and connective tissue, predominantly non-hereditary and usually unilateral. Bilateral leads to the Potter sequence, because if it is unilateral, you're not going to form Potter sequence because one kidney is working, so you're not going to see it. But if you have two kidneys which are not working, then you will see Potter sequence. So in here, what we are looking for is the fact that the first one, the unilateral renal agenesis, we have agenesis fails. So the ureteric bud fails to develop one thing. And then there's the failure of induction of differentiation of metanephric mesenchyme. That's the second thing. If you fail to develop ureteric bud and also basically fail to develop the metanephric mesenchyme, which is the other half of the kidney, right? So guess what? You have an absence of kidney and the ureter. I hope I'm making myself clear. You're failing this thing, and you're also failing the formation of metanephric mesenchyme, and these are the two structures which end up making all the from the glomerulus all the way towards the PCD, DCD, and the pelvis, the calyces, and pelvis, the calyces, and the ureteric ureters and all that, right? So if you fail to develop all of that, guess what? You're not going to develop any kidney, absence of kidney, and the ureter. But on the other hand, and this is a unilateral renal agenesis, no genesis, simple as the wording goes, no genesis of kidneys, and the pathology is right there. But on the other hand, you have the multicystic dysplastic. So you have the kidney, but they're dysplastic, in which case you are making the ureteric bud, but you are failing to differentiation into the mesenchyme. So you have no mesenchyme. So if you have no mesenchyme, guess what? You have no glomeruli, you have no PCD, the loop of Henle and the DCT, you have nothing. All you have is the collecting duct and all the rest of ureters and everything. So that is this thing that you already have. They will go and they will form cysts and the connective tissue, leading to formation of cystic, non-functional cystic kidney. Okay. Then we have the other one called duplex. Let's talk about duplex in the next one.